Hi, Dr. Burnett here, Doctor of Physical Therapy. Today we're talking about the rotator cuff impingement syndrome rehab protocol. First thing you're going to want to do is print out your protocol right here. So that's what we're going to be going over today. And today's video is all about phase 1, low load strengthening for the shoulder. And also, one thing you want to do throughout this whole protocol is we're going to measure, the outcome measure that we're going to use to see if we're making progress is the full can arm raise test. This tests the cerebrospinatus muscle, which is really responsible for a lot of the movement, bringing your arms up like that. So that's going to be our test that we're going to do, so be sure to do that before you start the exercises and then throughout these different phases of exercises. We'll measure every 2 weeks, and really what we're measuring is how far you can raise your arm like that, and then with how much weight we can raise the arm and be able to do that and decrease the pain as we're doing that. One thing on activity modification during phase 1, we're going to take out planks, loading the shoulder, lifting things over the head. We really want to decrease the muscle activation of that shoulder right now and really just bring it down to some basic low load strengthening of the shoulder. We're going to go over the exercises that we'll be doing. Pain relief, grab your Flex Cream. It's kind of a pain relief lotion, or your choice of pain relief lotion, and also ice, massage, and then also stop any activity if your pain level is above a 5 out of 10. Stretching, you can stretch as needed. We're going to go over one specific stretch, the chest stretch, and kind of open up that front side of the shoulder as well today. So first exercise, let's jump right into it. Phase 1 exercises. First one is really just called passive range of motion, and it's the broom arm raise test right here. And so what you're doing is, let's say that my right shoulder is the painful shoulder. So whichever is your painful shoulder, we're going to take a broom like this, and what we're doing is raising the arm up and really just letting that arm kind of stretch up a little bit past where normally you probably wouldn't be able to raise it. But now, since you're just letting this top arm relax as much as possible. Okay, so as you're doing this, I'm letting my painful arm, so in this case we're saying my right arm is the painful arm, and here I'm just letting it relax as much as possible, and this other arm down here, this is the one doing the work. Okay, we're going to do this just about 2 sets of 20, so just kind of get a nice stretch on it right here. Okay, so we've done about 6, 7, 8, 9, 10, and again, you're just getting that stretch on it right there. You're just kind of bringing it forward. And what I like to do is just come out to the side with it right there, but then I'll also kind of bring it forward as well. For about half of them, I'll go a little bit more forward, and then half a little bit more towards the side. Again, we're doing about 2 sets of 20 on these. This is really more of a warm-up, just kind of stretch out that shoulder. A lot of the times when you've been in pain, you've just kind of been letting that shoulder kind of freeze up and not stretch out as much. And again, you're just trying to let that shoulder, this top one, not do any work. You're just letting it just kind of sit there, just kind of rest on that broomstick as you're doing this. Okay, so 2 sets of 25 of those. Okay, now, after you've done that, I said 2 sets of 25, I meant 2 sets of 20, but really not a big deal on those ones. We're going to count the numbers on these strengthening ones a little bit more. Okay, this first one is shoulder internal rotation. So what you're going to do is you're going to take your red band, phase 1, we're using a red band. Okay, tie a knot in one end like this. Okay, so you're going to have a loop around this end right here, and then a long piece right here. You're going to open up a door, put it on the other side of the door handle, like this, right here, okay? And you got that locked in right there. And what we're doing with this exercise here is this is called internal rotation, so we're coming in towards your body right here. It's a 45-degree angle. I'm starting out with the arm just straight forward and coming in towards the belly right there, okay? What we're doing is 2 sets of 25 of this right here. Now, if you need a little bit more resistance, you can move further away from the door, like that, right there. or if you need a little less resistance, you can move a little bit closer towards the door. Okay. Coming in like this. Okay, so I've done about 10 right now, so we're getting 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Now one tip as well is that I want you to take a little towel like this or a shirt, wrap it up, put it underneath your arm. Okay, this actually helps stabilize that arm as you're doing these exercises. That was internal rotation. Now the other one that we're going to do is called external rotation. So that's going to be like this right here. So what I'm doing now is I just turn around, and instead I'm starting with my fist towards my belly right here and bringing it out like this, straight. Again, we're only doing about a 45-degree angle. So bringing the fist straight in front of me from the belly right there. So here we go, just like that. Okay. So again, we're doing 25 of these. There's 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Those may feel a little bit more, a little harder to do. And that's okay, because that movement is a little bit harder. You don't have as many muscles as this one pulling in, so you may need to step out a little bit more, give yourself a little more resistance for these ones coming in if you need to, and a little less resistance for the external rotation. Okay, so again, we're hitting 25 of these. I'm about 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Again, that was internal rotation. Now we're going to do external rotation again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Good. Okay, so we hit 2 sets of 25. Now, your next exercise is going to be, so we've already hit internal and external rotation. Those are really hitting the main rotator cuff muscles. Now, the next one that we're going to do is called standing rows. What you're going to do is take the band out, wrap the middle of the band around the door handle now, close your door right there. Make sure you got a door that's shut real well. It's not going to open up on you and smack you, so watch out for that. Now, this one is called standing rows. So what we're going to do is we have 2 bands now, and we're going to take these bands and pull them back and pinch our shoulder blades together. So if you look at my back right here, I'm taking these back and I'm pinching my shoulder blades together right here. It's rows. This is a movement called rows, but we're standing up and we're just pinching those shoulder blades back together like that here. We're doing 2 sets of 25 as well on these. We're just going to take a little bit of a rest after the first set of 25. It's the same movement though. Okay. Jump to 20, 21, 22, 23, 24, 25. Make sure you're getting all 25 in there. I'm not counting exactly, we're just showing you the movements here. Okay, so the next one, just take a little bit of rest there, and then just go right back into those rows. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Good, so that's the standing rows. So we've knocked those out. Now, you may need a little more resistance than what the red band can offer on those. If you do, you can contact me, we can get you another band out. Last one is a stretch. It's going to be a chest stretch, so it's a chest opener here. Now, the real way to do this is having kind of a doorway like this where you can, it's called the doorway pec stretch, and have an arm up like this. Now, this may be a painful position because if you have pain raising your arm, raising up like that, that may be too painful for you to get into right now. And if so, that's okay. Just bring the arm down like this, okay? And you can still get a decent stretch with the front of your shoulder and pec like this right here, okay? So we're just holding that for 2 sets of 20 seconds. Okay, so you're just holding that there. Hold, 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 hold. And again, if you're able to, you can bring that arm up a little bit more and then just get that stretch right here. You should be feeling a little bit of a stretch just on that front side right there. Often what can happen in rotator cuff impingement is the front side, our chest can get a little too tight, and we need to open that up a little bit more, and that helps relieve some of that shoulder impingement and tightness in there. So that'd be the other set is, again, 2 sets of 20 on the shoulder stretches there. That wraps up phase 1 for rotator cuff impingement rehab protocol. Be sure to watch the other videos to watch your progress for phase 2 and phase 3, which will come later. And contact me if you have any questions. You can see more at fourscorept.com. Thanks.